So welcome to you from my country, India, and my city, Bangalore. So what I'm going to do is, this is outline for my talk. I'll give a brief introduction as to what is the magnitude of the problem for non-small cell lung cancer that we're facing today, how we have evolved with chemotherapy, which has been a big backbone for many years. Then talk about how chemotherapy is used as a maintenance, then switch gears and go into targeted therapy, and finally into the immunotherapy, because that is one of the very important things that's coming. And no talk on non-small cell lung cancer can go without prevention, especially in this month, because this is a lung cancer awareness month. So I will touch a little bit on that and then some conclusions. So if you look at this slide, there's actually data from 1930 coming on into this century. And this is looking at the evolution of cancer death rates for males. And if you see, this is listed the various cancers that are afflicting mankind. And this is for men. And if you see the red line, this is for lung and bronchus. And as you see, it is exponentially increased as compared to the other cancers. And just about in 1990s, it has started taking a dip. And this has been because of the drop in smoking habits in men. And there is elegant epidemiological data today to prove that this is in fact true. And therefore, we really understand that smoking is one of the very important causes for lung cancer. So what about women? You can see that the lung cancer incidence increased for women only in around 1970s, but it continues to increase. And this again is because of the smoking habits that have continued to increase in women. We always thought women were smarter than men and they would have stopped smoking earlier. But it seems that they have other compelling reasons for which they continue to smoke. And that is reflected here in the increased incidence and rates of death because of lung cancer in women. So this is another slide. So just ignore all the numbers on the left side, because this is a little old slide from 2013. But on the right part of your slide, you can see that the estimated cancer deaths of the 4 major cancers, prostate, pancreas, breast, and colon, put together equals that of lung cancer. So that is how big the magnitude of problem of lung cancer is today in our society. Now, this was a question that was posed to the members of the American College of Thoracic Oncologists in 1995. And the question was very simple. They were asked that if you were diagnosed with non-small cell lung cancer stage 4, how many of you would take treatment? And in 1995, it was just 15% who said they were willing to take treatment for this stage of disease, because that is how the outcomes were at that point of time. But the same question, when was asked in 2015, the number jumped to a whopping 90%. So why is this so? And that's what I'm here to tell you about, why this change in number has happened. So let's start at the very, very beginning. So this is a seminal paper that was published in British Medical Journal in 1995, which looked at the role of chemotherapy in these advanced non-small cell lung cancer patients, for which till that time, all that we could offer was best supportive care. And with that care, these patients would survive for about 3 to 4 months at best. But this paper showed that the role of chemotherapy is definitely there. And this was a meta-analysis of over 8 trials, close to about 800 patients who were treated with cisplatin-based chemotherapy. And this analysis showed that there was an absolute improvement in survival of about 5%. And the median survival for these patients increased from 3 to 4 months to about 8 months. So that was the beginning of treating metastatic non-small cell lung cancer patients. And they also found
Dr. Sundar Murthy Anamalai from Chennai wants to ask you whether there is any role of stem cell therapy in NSCLC.
As of now, no. But there is work going on dendritic cell therapy, but people are really jumping the gun and using it routinely, which I will not advocate. We need to build evidence and only then offer it to our patients.
Right. Moving on to the next question. This one is from Dr. Sumi Joseph from Thiruvananthapuram. She's asking you, sir, EGFR study and TKI are considered in metastatic disease only, or should we consider them in early stage itself?
So I think she's talking about adjuvant therapy. As of now, it is not at an approved indication. There is exciting data to show that it is useful from early studies, but we need to wait for longer follow-up.